One of my patients mentioned to me that they had heard about somebody having an awake tummy tuck, and she asked me if that was a thing. And my response to her was that I know of no experts in my field who do awake liposuction or tummy tuck surgery. And it's actually rarely done by plastic surgeons. So the reasons that those procedures are commonly done awake would be either the person is not board certified or credentialed to do the procedures in an accredited facility like a major hospital or a surgery center, or that individual is trying to make it affordable for somebody who may not be able to afford to have it done correctly. So they're taking shortcuts with anesthesia. Unfortunately, this can be presented to patients as it's actually safer if you're not under general anesthesia. Well, that's not true, because to do surgery on patients, there's a certain amount of pain. And even if you try to inject numbing medicine, the act of injecting the numbing medicine hurts quite a bit. And there inevitably are areas that you just can't numb up. So what happens is you end up giving patients pain medicine and medicines for anxiety, because you can imagine this could be a very stressful, painful situation for patients. And most of the time, these patients then are not being monitored, because the same cost-saving thought means that no board-certified anesthesiologist is present to monitor the patient. And so now you're essentially doing a conscious sedation using oral medicine to sedate the patient. And the issue is the patient could stop breathing. Or if there is an intravascular injection of the numbing medicine, then the patient can go into arrest and can die. And there's no emergency services around. There's no anesthesiologist around. And more than oftentimes, those patients never make it to the ER because they've stopped breathing, and the medics can't get there fast enough. So not only can it be unsafe, also, if there's a complication, then you have to be brought to the operating room. There's just a whole list of problems that are almost too many to expound on here. So bottom line, this is a red flag. You should never be having a tummy tuck done under local anesthesia. In fact, you should never be having liposuction done under local anesthesia for the same reasons. Insist on it being done at an accredited facility, and make sure that your surgeon is not only a board certified plastic surgeon, but also can admit you to a hospital and has credentials to do your procedure at a major hospital. That is the only way you can ensure that they have privileges to take care of you if there are complications. Keep that in mind, and you'll stay safe.